Hey, welcome back to our website, brainmindbody.com. My name is Dr. Karnik, and I'm a pediatric neurologist. And today I'm going to talk about probiotic. Many patients have asked me in last many months to talk about this topic because it's a hot topic, and they want to know what is the right way of doing it. So I thought I'll give you a little science about probiotic and tell you how we can use it for our benefit. So for next 10 minutes, we're going to concentrate on a topic of probiotic, how we use it, what they are, and how you can purchase them from different sources. So let's come back to probiotic, and as I said, I will talk about them in the next 10 minutes. So before we go, let's try to see what is probiotic. Now, we all know that we have many bacteria and yeast in our gut. In fact, we have about 1 to 2% of our body weight in form of some bug or the other. So if you are 100-pound person, then 1 pound or 2 pound weight that we have is due to bacteria that we have. So we carry a lot of bacteria. Now, if we see that we have most of the bacteria that are healthy and they help us. Very few bacteria or type are unhealthy and they produce infection like gastroenteritis and so on. So probiotic are generally considered as substance that stimulate growth of beneficial organism in gut. So you take this either in form of pill or a liquid, and then they go into our in our intestine, and they improve growth or stimulate growth of healthy bacteria, and these healthy bacteria are very useful for us. They are therefore live bacteria, and sometimes they could be yeast. Probiotics are often called as good or helpful bacteria because they keep our gut healthy. And the best example that we know is yogurt, and we'll see some of the other examples as we go down. Now, there are many benefits of probiotic. What they do is they keep balance between healthy and required bacteria to unhealthy and not required bacteria. As you can imagine, we have more healthy bacteria, and these probiotics encourage development of healthy bacteria in our gastrointestinal system. An imbalance means there are too many bad bacteria and there are not enough good bacteria. Now, this situation can happen if you take antibiotic for a long time, or if you have some condition like gastroenteritis or diarrhea or nausea, vomiting, and so on. In that case, we have much more bad bacteria, and we want to create that balance as quickly as possible, and these probiotics can help you to have that. If it happens due to illness or medications such as antibiotic or poor diet or poor health, your job is to make sure that we get this balance under control as quick as possible. And that is one of the best reasons one should take probiotic. Now, there are many benefits. Let's take some of the benefits. The first one is prevent and treat diarrhea. Now, many patients have noticed that when they take antibiotics, they will have diarrhea in second, third, or fourth day. And one of the reasons is bacteria or other antibiotics are killing healthy bacteria, and therefore we have imbalance and we have more non-healthy bacteria. So it helps to control such diarrhea associated with antibiotic. A disease or infectious conditions such as diarrhea, when you have that, give a probiotic and it will reduce the duration of that illness. Now, some of the ones that are called Lactobacillus rhamnosus or Lactobacillus casei, and many others like Boulardii are most commonly associated with reduced risk of diarrhea. So if you want to choose, if somebody has a diarrhea, these probably are the ones that will help you if you take those in your probiotic. The other benefit of probiotic could be eczema in children. There is a very good correlation between eczema, and if you take probiotic, their eczema will improve. Some of the other ones could be inflammatory bowel disease such as ulcerative colitis or irritable bowel syndrome, as we call it IBS, or necrotizing enterocolitis. Generally, you see that in premature babies where they have more pathological bacteria. You want to prevent it or you want to treat it, many times probiotic could be useful. It also boosts immune system and reduce the duration of respiratory illness. Studies after studies have shown that children who took probiotic, they have less respiratory illnesses, or the duration of this respiratory illness was shorter. Now, Lactobacillus, again rhamnosus, which we said before, or Gasseri, are the ones that have shown quite well for GI system, but it's also good to reduce weight. And so somebody who wants to reduce weight, then probably that type of probiotic is going to be useful. And we'll talk a little bit as we go down. There are also probiotic beneficial for brain health and mental state health. For example, studies have shown that probiotic can help anxiety, depression, autism, obsessive compulsive disorder, memory, in general health, and also stress. And those who have this condition may try certain form of probiotic, and they can be useful. Now, before we go further, let's try to understand three different things. The first one is probiotic, which we talked, prebiotic, and symbiotic. Now, probiotic are the substances that encourage the growth of healthy bacteria, and these are the healthy bacteria you take from outside source. Whereas prebiotics are not bacteria, but they are fibers, they are nutrients, and they encourage naturally occurring bacteria that we have in our brain system, or rather in our gastrointestinal system. And symbiotics are the biotics that have both prebiotic and postbiotic, and these forms are available in market nowadays for anyone to try. Now, there are also some food sources that provide probiotic. The classic example is yogurt, especially live yogurt, but there are many others like kefir or sauerkraut or tempeh or kimchi, and again they have live healthy bacteria and they can help you. Now, what we need to know when you do choose probiotic, and what has been done so far. First of all, you got to know that this is a very new kind of ideation in medical field, and we still need to know much about it before we feel very comfortable. So a lot of research has to be done, but current research has definitely shown that this probiotic can be useful. Some probiotic may help to prevent diarrhea that is caused by infections or antibiotic, and that has been proven beyond doubt. They may help irritable bowel syndrome, and clinical studies have shown that they do help people with that condition. Benefits have not been conclusively demonstrated in many other conditions, but they may be helpful, so you have to use under guidance of a physician. Not all probiotic have the same effect. For example, some probiotic can elevate the moods and anxiety, whereas the other may help you to lose weight and some other may help you to improve your GI status. And therefore, you need knowledge, and therefore don't just try to buy something right off the shelf. Try to get advice from your physician or someone who is expert in this field rather than just trying to figure it out yourself. In healthy people, probiotic usually have very, very minor side effect, if at all. But people with underlying medical conditions such as weakened immune system disorder or frail health status or a cancer or very young children, especially premature babies, they don't tolerate this probiotic and therefore either use very cautiously only under medical guidance or don't use it at all. Now, the type of bacteria generally used in probiotic, there are many types of bacteria. The classic example is lactobacillus or bifidobacterium. They are the ones that are used most of the time. Now, there are many other forms of lactobacillus and bifidobacterium, and so you may see some variety of different strain in probiotic, but those are what you're going to see. There are also some other bacteria available, and we'll have information on my website, those who want to know more about it. And some may have even yeast and not just bacteria. So how do we select the right one for you? First of all, try to find out that some good scientific data is behind the product. If some physician is involved or some of the researchers, scientists are involved, then I think that may be a better choice for you. Should have a very high bacterial content. They should have at least 40 billion counts, and that is very important. Should have multiple strength, because not one strength help it, so you got to put bunch of strength together. And you should have about 9 or more strength in a product. If they have prebiotic along with probiotic, then it is a good idea because it will stimulate your natural healthy bacteria too. And try to select something that does not need refrigeration, because sometimes you cannot have refrigerators all the time, and therefore you really need some refrigeration free probiotic. Now, there are a couple of examples. For example, complete probiotic is one example that is suggested as one of the good one. Pro 45 is another one, or Critical Care 50 billion is another one. We don't have any recommendation at this stage as we are trying to vet them, but these are said to be good, so you may try them, though we don't have, as I said, recommended as well as endorse them. There are few that improves mood, and those who have anxiety or mood disorder, you can use this probiotic, and these are the two ones that you see here, the two forms of lactobacillus and bifidobacterium. They generally can use to improve your status, so they can be used for ADHD, autism, anxiety disorders, and various things. When it comes down to probiotic use in children, you got to make sure that they are safe or they are made for children, and therefore got to be safe for children. Now, if child has immune disorder, cancer, or premature or other medical conditions, don't use them. They may not be good for you. Studies have shown that respiratory illness and diarrhea improve in children when they are given probiotic, and there's some data on it. It's better to give probiotic through food than real one in children. And if you really want to use probiotic, make sure that you always consult your pediatrician or health care provider. So, probiotic for children, there are many types available in market. I have selected few, though I have not endorsed them, as I always like to vet them very well. So this is not something we endorse at this point. But Garden of Life probiotic for children, Nature's Way, Cultural, and rainbow light gummies. Now they can be used, many people are using it without any problem. This is what I found in research. As I said, I have not vetted them well. So what you need to do before you consider probiotic: first, do not replace what is your current therapy. If physician has prescribed you something that you need to take, then you need to take that. This is not in lieu of any therapy or any treatment that you are receiving. You always must consult your healthcare provider or your pediatrician before you use them, because they need to select the right one. Not all probiotics are good for every condition. Certain conditions need certain type of probiotic, and the other conditions can get better with some kind and worse with the other kind. So you really have to be very careful. On my website, we will give you some examples of different probiotic. If you are pregnant, nursing a child, or child is very, very small, don't use it. And tell your healthcare provider that you are going to use it. It's very important. You must, therefore, do not replace what is the therapy or treatment required and prescribed by a physician. These are not something that will replace them. Consult your healthcare provider first before you use it, because it's very important that they got to advise you well.